Assisting with controlled coughing and deep breathing. For this procedure, you will need exam gloves, tissues, a water pitcher and glass, an emesis basin or disposable sputum cup, a paper or plastic bag to dispose of tissues, a stethoscope, and pillows for splinting the client's chest and abdomen. Provide for privacy by drawing the curtain. Verify your client's identity. Wash your hands and don gloves. Explain the purpose and importance of the procedure in preventing atelectasis and pneumonia. Help the client to sit in a semi-Fowler's position in bed or up in a chair if possible. Auscultate the lungs before the procedure. Place the palms of your hands on the client's rib cage. To help decrease the pain that occurs with deep chest expansion in post-operative clients, have the client hold a pillow or folded towels over the abdomen or chest to splint the incision. Practice deep breathing with the client to promote loosening of chest secretions. Instruct the client to take a slow, deep breath in through the nose and then exhale slowly with pursed lips through the mouth, as if gently blowing out birthday candles. Have the client repeat the exercises 4 to 5 times, then repeat every 2 hours, while awake, as needed. Reassess the lung fields after the procedure. Next, assist the client to perform controlled coughing as follows. Give the client tissues, a sputum cup or basin. Help the client to splint any incision areas as appropriate. Follow the procedure for deep breathing and have the client hold the breath for 1 to 2 seconds. Ask the client to contract abdominal muscles and cough while exhaling to expectorate secretions into a tissue or basin. Repeat as necessary to clear the lung fields, but avoid excessive coughing as it can irritate the trachea and bronchial tree. Clients with chronic respiratory problems may need to repeat the procedure at more frequent intervals, but with fewer coughs. Adjunct therapy may be necessary. Auscultate the lungs after the procedure to check for the clearing of secretions and improved aeration. Observe the client for dizziness, shortness of breath, or other respiratory problems that may indicate hyperventilation. Help the client gargle and rinse out the mouth after coughing up secretions. Dispose of all tissues in the appropriate biohazard receptacle. Remove your gloves and wash your hands. Document the procedure and the client assessment.